Well, good afternoon, everyone. Thank you. Good afternoon, everyone. All right, there we go. It is my privilege to be with you at this program. I want to thank the pastor for his challenge at the beginning of the lunch today. I'm going to try and rise up to that challenge. I want to thank also Mike and Russ. We've heard that. I don't want to be redundant, but our organization, this foundation, is built on the shoulder of giants, and both of you are certainly giants, and we very much appreciate your commitment and your contribution to the organization. So thank you very much. I also want to recognize the two youngsters that are over here, Richard and Lauren. They are full of energy, and we've got jobs waiting for them, so just, kind of let us know when they're ready. Okay, some of you may have noticed Richard was kind of looking at the steps earlier, and he was thinking, should I go up there? And I watched him glance over at Grandpa and say, and so we came up here, and he wanted to know about the technology, and how does that work, and how does it get on all screens at the same time? Great set of questions. So love to see that inquisitiveness, and I think that's what our foundation is about. It's really digging in and connecting with people where they are, and really trying to be sensitive to how do we personalize that health and healthcare journey. And I always explicitly say health and healthcare, because for too long, our system has been a system of sickness care, which is important, but it's not the whole equation. And I know I'm preaching to the choir here, right? Health, wellness, prevention, being on the front end of the system is not only the thing to do, it's the right thing to do. It's where a lot of investment needs to happen, because it's morally right to keep people healthy in the first place, not just wait to deal with them on the back end of a system that for too long has had a financial incentive that meant the more you do, the more you get. And we really have to take that system and change it to be a system that says, how do we keep you well in the first place? And how do we give you what you need, where you need it, when you need it? And that really is revolutionary to the way health and healthcare has been viewed in our country. So when we talk about ourselves, there are some that would like to pigeonhole us and say you're an insurance company. What you do is pay claims. Hopefully everyone in this room knows we're a lot more than paying claims. Do we pay claims? Absolutely. Core part of our business, we'll always do it. In fact, we pay claims not just for Florida. We do Medicare A and B claims for 16 states. In the upcoming year, we'll pay $120 billion with a B claims across those 16 states. So it's an important thing that we do. And we try and do that as well as we can. But what we call ourselves is a health solutions company. And what does that mean? When we first started using that jargon, we had some in our own company who said, I want to know what health solutions means. Could you write it all down and tell me what the definition is? And part of my way of managing is to say, help us build the definition. You're all empowered to bring your brain to work each and every day. We don't have all the ideas, and guess what? We won't have them inside this company. We need to talk to people. We need to partner with people. We need to be a collaborator and an integrator. And that will all come together to build what a health solutions company really is. So when you hear some of the things that Russ has touched on for the foundation, lots of things in that set of activities speak to being a health solutions company. Because we talked about the whole person. We didn't just talk about the care on the back end of an acute episode. We talked about education and literacy and the intimate connection between literacy and health status. Absolutely critical. I am the beneficiary of lots of great opportunities in this role. I feel extraordinarily blessed and privileged to have this job. I get the opportunity to travel all around the state and see incredible work being done by our folks, being done by partners in the community, and at the risk of naming just a few, I will outline a couple that we do, but there are thousands of great works going on every day. I had the opportunity in this community at the Paramore School, Paramore District rather, at the Knapp Ford School with Tony, where we went over and we had a grant check from the company for their health and wellness program at the school. Now, coming out of that, I got to tell you, Tony has a videotape that Tony knows what I'm talking about. That better not ever show up anywhere. Because one of the things they do is they did their third grade exercise program. And of course, when we're standing there, they say, aren't you going to be part of this? And I said, well, of course I'm going to be part of this. So I jumped down on the floor and they say, great. Because our yoga program, we stand like squirrels. Yeah. And then the next thing they said is, now we get down on our belly like sharks, and then we chomp, and so I'm on the ground, I've taken my jacket off, and I'm chomping away. The kids are laughing their heads off. And Tony's over there with his iPhone, and he's gotten a really strong review this year. But it's those opportunities to see these kids completely engaged in their health and wellness that gives us promise and hope for where the system can go if we think about the front end of the process. So we're an advocate for having physical activity in schools. We shouldn't be talking about how do we cut out gym and after school curricular activity. We should be talking about how we absolutely integrate that into the programs, and we're happy to advocate for those. At the same time, we advocate for the arts, because it's the whole person. Art programs, music programs, we shouldn't be talking about cutting those things out. We should be talking about investing in those programs, because what we know about health is that the whole person really goes into the well-being of each and every one of us, right? So if we're investing in those programs, we're really saying that we care. We care deeply about the well-being of the people that we serve. And so we have programs like in Jacksonville, Cathedral Arts, where they're bringing art programs to kids in schools that have cut them out because the budget demands got too tight. That's a valuable and important program. We had the opportunity to bring the Mal Washington Kids Foundation to our campus. For those of you who don't know, Mal Washington was a professional tennis player. Post his career, he set up this tennis camp foundation that has become a before school and after school program in North Jacksonville. And those kids are staying in school, they're committed to what they're doing. Some of them play tennis, not all of them play tennis. It's not about tennis, it's about the kids. But what was fun when we brought them to our campus, and the whole idea was give them an opportunity to see another path, a path through a career, a path where they could stand in front of people and stand and speak in a public setting. And we had a number of our executives who addressed them that day so they could see people like themselves in senior positions that had made a career path for themselves through education, through listening to their parents, for being engaged, for doing the right things. And that's what makes a difference. And one of my favorite pictures is that we took all of the kids that came and visited us and had them sit in the CEO chair and envision themselves as CEO for the day. And we gave each of those kids back a picture of themselves as the CEO. And I'm telling you, after a while, first couple of kids, very respectful, very polite, hands on the desk. The next couple of kids, feet up on the desk, leaning back, feeling like they're in charge of the world. And that's what we wanted. We wanted them to express themselves and really get comfortable with that idea. Now, Mal Washington told me that on the bus over to our campus, it was sort of a glum setting because the kids were all going, we're going to an insurance company? what are we going to do today? Well, I don't want to do this. And on the bus back, he said the energy was off the chart. They were excited, they were talking rapidly, they were talking about their pictures, they were talking about all the different people that they had engaged, they were talking about our lunch setting, they loved our cafeteria, they had lots of things to think about and talk about. And that's empowering, and that makes a difference. I had the opportunity to serve Thanksgiving dinner now twice at the Miami Rescue Mission with the Miami Heat team, lined up and watching people come through. Because when we're talking about the whole person, it's also nutrition. But you know what? It's kind of a high-level concept to talk about nutrition when some people are hungry, right? You really have to get at all of the issues in the health continuum. And if we want to be in the Medicaid space, we need to be thinking about people who have absolute needs at very basic levels, right? So that's been an enlightening and empowering opportunity for me to be involved in that with our team down in Miami. We had the opportunity over in Tampa Bay to do Feeding Tampa Bay. And one of the things I loved about what we do there is we took their whole refrigeration program and changed it so that they can store fresh food. Because one of the things I know over a number of years is a lot of food pantries have the industrial sized stuff with a lot of preservative, and they're not necessarily feeding people the best stuff. Well, why? Because it's cheap. But you know what? If we have the infrastructure, we can feed people well, because if you don't feed people well, you have other problems down the continuum, and we know this, right? So it's a matter of how do you invest to make sure you're making the right investments to change the system that we have in this country. We spend enough money. We don't spend it well enough, right? So when I hear, gee, the Medicare Advantage plans got cut by 8%, we better go into a shell because that's a problem we can't deal with. I challenge us to think differently about that. And the challenge is, if we do the same thing we've always done, why should we expect something different? What we have to do is do something different to manage inside the constraints that are coming at us. And that message will repeat itself. Because guess what? State government is going to continue to cut dollars. Federal government is going to continue to cut dollars. We see the debates that are going on there. And so we all need to be thinking about how do we do things more effectively. So some of the things we've done on the business side is we've created a number of different relationships with the providers of care. Patient-centered medical homes. We have 2,300 physicians statewide, one of the largest patient-centered medical home networks in the nation that we've created here in Florida. Already the results are telling us that paying more for primary care is producing a better, higher quality, more efficient outcome on the back end. In our state, we need to continue to advocate for people operating at the very top of their license. We need nurses more actively engaged in primary care because we allow that in our state. We're behind the 8 ball in Florida on that particular issue. And as we bring more people into the system, we've got to open the system up to address the needs where the patients are, right? And so that's going to be a critical policy issue for us. We've created 6 accountable care organizations. And by the way, when you hear that term, if you've seen one, you've seen one. They're all different, and people are in different places. So some of ours are disease-specific, and some of them consider the whole population that are being admitted to that institution, and some of them are for the employees of that institution because they want to put that toe in the water before they change everything. But why are we creating those entities? Because we're taking our system away from fee-for-service and starting to move it towards paying for value and paying at a more global budget basis, so that we put our emphasis on the right things, not just on volume, but on value. That's a huge shift for the system. It will take multiple years to get there, but we are committed to getting there. We're committed on the policy front. I'll share with you that last week, great timing, we happened to have the opportunity to be sitting there with Marilyn Tavenner at CMS, and she asked us point blank, do you support the Medicaid waiver in the state of Florida? Answer, yes. Tell me why. Why? Because a year and a half ago, we created a joint venture with AmeriHealth, and I know some of their folks are here. They've been in Medicaid for a number of years. They have Medicaid dedicated systems. We knew that we needed to combine with somebody who had brought that expertise to be ready to operate in the Medicaid world. So we created that joint venture. In December, we invested, and we're now a 40% owner of the Prestige Network. And many of you in the room probably know Prestige, but they have federally qualified health centers all across the state, and we're a significant capital partner to their organization. Why? Because they're based in the community. They know what the needs are. They know what the challenges are, and they needed a capital partner. And we stepped up to that. So when Marilyn Tavenner was looking at us to say, are you prepared? We laid out what we've done over the last year and a half to be prepared. And she looked at us and she knew that having Florida Blue in Medicaid made a difference. Made a difference. It was a credible player and gave her more confidence about the decisions she had to make. Just a few days ago, we were sitting in Tallahassee when Governor Scott announced that he supports the Medicaid expansion. We've been advocating for that for months. That's the right decision. And Governor Scott has said to us, I've stuck my neck out. I've made this commitment. You, Florida Blue, and some others in the room, you need to help sell this because we have to get it through the legislature. And we have said we will do that. And I can tell you already, I've talked at the Jacksonville Chamber and the Miami Chamber about why business should support this Medicaid expansion. First of all, it's the right thing to do, and that should be good enough. But if you need more than that, if you appeal right at self-interest, we know that expenses that aren't covered in one sector get shifted to the other. So if you're not invested in the Medicaid program being funded appropriately, those costs end up in the commercial sector. So all businesses pay more if these dollars don't come to Florida. So there's clear self-interest in this. And we will continue to advocate for Medicaid expansion with any parties in the legislature that resist that notion. So I wanted to be clear about that with you. So it's a complex, we use the term system, it's not a system, right? It's fractured in so many different ways. What we know is that collaboration is the answer. What too many people have tried to do is think about who they're going to eliminate from the system so that they're advantaged. And what we've been spending our time doing is talking to hospitals, talking to doctors, talking to community partners, working through our foundation, and thinking about how do we collaborate better, more effectively, to have the maximum impact we can have in the community. Not to think about who do we eliminate so we get greater advantage. Although if it's a direct competitor to us, we'll consider it. But really, we have a great opportunity. Some folks, when I got the CEO job in Minnesota, said to me, my condolences. You know, the country had just hit economic downturn. Healthcare was in the national spotlight. There was a lot of pressure. And there's lots of reasons to think down. I do not spend any time in that place. This is the greatest time to be in health and healthcare. We can look at each other and say, boy, we've got a lot of burdens. We are at the crossroads of major change. We have the opportunity to fix one of the greatest problems in front of our nation. And the only way we do it is through collaboration. It's through working together and understanding that we all bring value to this equation, and we are dedicated to making a difference. So the bar has been raised. Some of you may have heard, if you listen very closely, the governor say, I'm taking it for 3 years because the feds fund it for 3 years. I think that's a challenge to all of us to change the system, to make it deliver better results, to make those results be delivered more cost effectively. And we want, at the end of those 3 years, to be certain that the conclusion is we have to stay in this program, we have to be committed to the expansion, because look at the difference the community made when it came together to meet the challenge of this 3-year window. Florida Blue is prepared to play its part. I'm thrilled that all of you are here so that we can talk to you about how we play this rollout together. I know we've got awards to do here in just a moment, but it's been a thrill to be in front of you today, to hear your stories out in the hallways. We're proud that between our company and our foundation, we granted $13.1 million across the state of Florida to deserving programs everywhere. And we're about to give out awards that are total almost $300,000 to some very special award winners. This is a program that we will absolutely continue, and it's my privilege to have the opportunity to talk to you today. Thank you.